Hello, hello, Jessica Wonders here. You are here to go over the course about preparing your home for surgery. Let's get into it, guys. I'm going to go ahead and share my screen. Really quick before you get into it, an intro. My name is Jessica Wonders. I'm a certified integrative women's health coach with a specialty in endometriosis. I am here to empower women to heal so that they can live soul-aligned lives of abundance. Here is my disclaimer. This is for educational purposes only. Please seek the counsel of your doctor, nutritionist, or dietitian before implementing any of these changes recommended. Also, my pledge to inclusivity. Now, we are going to talk today about healing, setting up a good healing environment for yourself. So let me get into that. So healing environment. We want whatever the space you're going to be in. So like if you think you're going to hang out on your couch or you think you're going to hang out in your bed, that's the space I'm talking about, or maybe it's both spaces, and that's fine. We want it to be free of clutter. We want to remove rugs or other tripping hazards, especially if you will be needing crutches or a walker after surgery. We want to make sure electric cords and throw rugs and toys and furniture are all basically out of your way. And non-slip surface in your tub and shower would be a great idea as well. Now, install night lights to your like from wherever you're going to be sleeping to get to your bathroom in the middle of the night. Make your area as comfortable as possible with blankets, stuffed animals, comfortable clothing, soothing music, candles, flowers, heat pad, whatever you think you're going to need, ice pack, whatever. Free your home environment of negative people. That is the best advice I can give you today. Free your home environment of negative people as best you can. Place a comfortable chair outside so you can enjoy nature while you recover. Now, if it's like a crappy time of year, like winter or something, and you won't be able to actually go outside, or just like do this anyways, if you can set up your bed or your couch, wherever you're going to be, so that you are facing a window so that you can look outside. I don't care if you live in a high-rise apartment and all you can see is the sky, or maybe the trees outside, whatever it is. There have been studies proving that literally just seeing nature, even if we're not in it, can help us heal. So do that. Clothing, do laundry ahead of time, put clean linens on your bed, like, the morning before you go to your surgery. Set aside clothes you will want to wear so you don't have to open drawers, reach, bend down, that kind of thing. Plan and pack the clothes you will wear home from the hospital. Now choose loose and comfortable clothing. You will not want to wear any tight-waisted bands on your pants if you're having a pelvic area surgery. I recommend loose, flowy dresses, something similar to those. I say old school because like it's not even like a thing anymore, but LuLaRoe, those Carly dresses that they have, those have always been my go-to. It's literally the only reason I own them. So easy to get on and off clothing. Lifting your arms may be difficult at first when dressing. So think about your shirt and the style of shirt that it's going to be. Make sure it's easy to get on and off. And of course, if somebody's there to help you get it on and off, that's even better. And then consider getting compression socks. Now, hospital healing. Let's talk about that while you're at the hospital. Plan ahead to pack things that will make you comfortable. So a robe, slippers, comfortable clothing, a blanket, relaxing music, etc. Surround yourself with supportive people. Whoever you have at the hospital with you, make sure it's an important, a supportive person in your life. See if you can get a window that overlooks nature or have a picture of nature in the room that you're on, even if it's on a phone or a computer screensaver to look at while you're recovering in there. Now, pack healthy food to bring with you for your hospital stay. Bring your loose, flowy clothes to wear home. Bring a pillow or two for the car ride home. You'll definitely want this to brace yourself, like to put your seatbelt on, if that makes sense. And then Depending on your vehicle, you may want a step stool to get in and out of your vehicle, and bring a vomit bag home with you from the hospital for the car ride home, just in case. Nature for recovery. A 1984 study at Texas A&M University found that surgery patients who had a view of trees had significantly shorter recoveries than those who looked out at brick and mortar. In a 1999 Swedish study, postoperative patients whose rooms contained landscape paintings healed more quickly, with less pain and anxiety than a control group. A third group looked at as abstract art and actually felt worse mentally and physically. Take home message here: just looking at a postcard of a natural scene can enhance your health. Equipment: grabber, reacher, shower chair, long-handled sponge for bathing, crutches, assistive device, adjusting your home to accommodate those needs, right? And having those things where you will need them. An example, like if you have a bending restriction, is why this would be helpful. Move items that you can often, that you use often, to where you can reach them easily. Have someone home with you 24/7 for the first 3 to 5 days, if possible, at least like the first 2, like at the very, very, very least, the first 2. So like a Friday surgery would be great if you're having to rely on someone else to help you out, so that if they don't work on the weekend, of course, there's people who work on weekends too, but ignore me. Anyways, have all of your needs, your meds, your snacks, your drinks, etc., all within a close reach to you in your bed or healing spot. Time for healing. Allow yourself time to heal with no commitments. Don't schedule events in case you don't feel well. Have good movies, books, magazines, etc., to keep you occupied and take your mind off of pain and boredom. Allow yourself to rest as much as possible. Allow yourself to sleep as much as possible. Your body goes into a cellular healing mode while you sleep. Do not push it, and ask for help. Tips and tricks for healing. Surgery may change your cycle, your period, your menstruation cycle. You will likely bleed after surgery if you are having laparoscopic surgery related to endometriosis, adenomyosis, or possibly other pelvic related surgeries. It may or may not be an actual period for you, though, if you're bleeding right after, just FYI. Most people experience painful periods so this is, this information is specific to deep excision surgery for endometriosis. It can also be applied to adenomyosis as well. Most people experience painful periods for the first 3 to 4 cycles on average, and this is what I have gathered from discussion and support groups. So this is just me gathering information. If anything feels too extreme or lags on longer than it should, call your doctor. But it is normal to have crampiness, blood, like period type pains after the surgery. I mean, they literally, if you're having deep excision surgery, they're literally, possibly cutting diseased tissue out of your body. So yeah, it's going to leave some things that need to heal, and it's not going to be comfortable. I'm just going to tell you that straight up. There are way too many people who go into deep excision surgery for endometriosis, or even laparoscopic explorative surgeries, which I don't recommend. And if you're wondering why, please go seek out my deep excision surgery course. You can find it referenced on my website, Endo Wonders. But anyways, way too many people go into it thinking like, I'm going to have this surgery and I'm never going to experience crampiness or pelvic pain again. And it's like, whoa, sister. It actually takes 6 months to 24 months for your body to fully heal and recover from this type of surgery. And doctors are not going to tell you that. That is coming from an integrative medicine and functional medicine viewpoint. But regular Western medicine doctors are not going to prepare you for that. They're not going to tell you that. So I'm here to tell you that. So most people experience painful periods for the first 3 to 4 cycles on average. And this is what I've gathered. Sorry, I already read that. I'm so sorry. Why am I doing that again? I am a terrible course creator. Just kidding. No, I'm not. I'm amazing. Affirmations. Beautiful self-talk. Okay, moving on. Make sure the space you will sleep and rest is clean. Clean your sheets and your bedspread before surgery. This is not something you will want to do after surgery. Okay. Ask a friend or family member to stay with you for the first 24 hours at home at a minimum. I know you know what? No, I'm sticking with my 2-day minimum. I honestly prefer 3, but anyways, whatever. I guess I can't settle. That's just my indecisiveness because I'm a Libra. Sorry. Okay. Here we go. My personal preference is 5 days, and this is what worked for me. So of course, if someone can't be present 24/7, at least have them stop by to check on you. Have all of your laundry done ahead of time and easily accessible. You won't be able to do laundry right away, and you won't want to be bending down to grab clothes. So make sure everything you have is in reach. Set up a table near your resting spot with all of your goodies within reach. Have your snacks and foods pre-cooked and easily accessible. Have a therapist who works with chronic illness and pain warriors on hand if you think that you're going to need assistance with your mental health relating this. And if you don't have one, consider it. There's a mind-body connection here, and working on your mental health will help your physical body, I promise. Anyways, that's just unsolicited advice. Okay, tips and tricks for healing. Stay hydrated, my friend. You may not feel like it, but try to drink as much water as possible, keeping in mind that the general recommendation is to drink half of your body weight in ounces every day. Though don't beat yourself up if you can't pull that off at first. Hydration will help keep your bowels moving though, so do ice chips if that's all you can handle. Get up and move at least every 2 hours or whatever your doctor recommends, even if all you can do is walk 5 to 10 steps or minutes around your house. Start small and keep going. Moving your body will also help keep your bowels moving. When showering and bathing the first day, or even better, the first few days, have someone available in case you need assistance with that. Have movies or Netflix on deck to help distract yourself and to help keep you from overdoing it. Rest, rest, rest. And do not feel bad for sleeping all day and night. Our bodies go into healing mode while we sleep. Keep clean and shower or bathe daily or every other day at the least. This will help fight off any skin-related infections and keep them at bay. More tips and tricks. Try not to Try not to talk too much in those first days. Talking brings that gas that was pumped into your belly. If you're having deep excision surgery or laparoscopic surgery, there was gas that was pumped into your belly to allow them to do that surgery. And that gas kind of moves up and into your shoulders. And when that happens, it's super painful. And the way that it moves up and does that is actually through you talking. I was able to completely avoid this because I got this advice before my deep excision surgery. And yeah, I'm really glad I didn't experience that because I know people who did, and it's not great. If possible, set up your healing space where you will lay, rest, sleep, somewhere that you can easily view the outside. I keep saying this because I believe in it. Nature, you want to see outside, you want to see nature. It's healing for us, even simply looking outside. Healing is not linear. Let me say that again. Healing is not linear. And you will have good days and you will have bad days. Your doctor might tell you that you will be ready for work in X number of days or X number of weeks after your surgery, and you won't have restrictions after X number of weeks. But truly, from an integrative healing perspective, after a surgery like deep excision, for example, it takes 6 to 24 months to fully heal. Give yourself grace during this time and do not push your body too hard. Trust your inner healing intuition and listen to your body. Our mental health can suffer after surgery. Here are a few things I did to help keep my mind healthy during this time. Daily affirmations, a gratitude practice, and merely saying to myself what I was grateful for. This shifts the focus onto the positive instead of worrying about the challenges, since they will ebb and flow. Journal. For a lot of people, it is healing to write, even if you're the only one ever to see those writings. If you don't already journal, maybe consider taking that up while you recover. Things to buy ahead of time. This is specific for people with endometriosis, adenomyosis, anybody undergoing pelvic related surgeries, but you need to approve all of this with your doctor. So these are things that can help. A heating pad, they do have extra large sized ones, an ice pack. If you had deep excision surgery, that ice pack is going to be really helpful with the inflammation and swelling on your belly. You can do this every 2 hours for 20 minutes for the first week would be great. Make sure you get permission to use a heating pad though. And then a stool softener would be great. There's Colis, I think, or Colace is the brand. That's just like an over-the-counter deal. It's less aggressive than others. That's why I like that one and recommend that one. That one actually was recommended to me by my doctor too. Gas X can be helpful for obvious reasons. And then peppermint tea if you are somebody who struggles with nausea. Now, tummy drops are also good. These are just a hard candy that you suck. These are great for bloating and nausea. Peppermint essential oil. This is also great for nausea. And like if you're dry heaving, for example, to avoid vomiting, just sniff it. And then this can sometimes happen when you're coming off of anesthesia that you'll get really nauseous. So be prepared for that, or even vomit. Tylenol and Advil, of course, consult with your doctor first. Some doctors ask your doctor, like, okay, if you're telling me that you want me to take Tylenol and ibuprofen, like, do you want me to swap them off, and how often? Ask those questions, how regularly they want you to take this stuff, and for how long, like when you should stop taking it. I even suggest that you set alarms to remind you to take your medication, even to wake you up. Because if you take meds, you go down to take a nap and you sleep for 8 hours and you miss your meds, you're going to wake up really in pain. And it is a lot harder to get back on track than to just simply wake up for 2 minutes, pop some pills and drink some water and eat a bite of food for your tummy. That's the easier way, guys, I promise. So continued information related to that. So what to buy. So loose and flowy clothing, avoid pants if you can. Not sure if you remember those Carly dresses. I mentioned those before from LuLaRoe, but those might work. And let's see. So also depending, like if you are having pelvic related surgery or lower extremity surgery, ask the doctor what kind of soap you should wash your body with before you go in for surgery. So usually they'll ask you to bathe and scrub your body the night before and then the morning of. And they'll usually recommend things like Dial or antibacterial soap, but they're going to give you a specific recommendation, and please follow that. And then make sure you do that as well, because they're wanting you, if you're having incisions on your pelvic area, they want that area of your skin clean so that there aren't any infections. So also make sure to stock up on your favorite menstrual products so that you have them on hand when you get home. If you are having deep excision surgery, laparoscopic surgery for endometriosis, adenomyosis, or any other pelvic pain conditions, I personally, as someone who's gone through all of this, do not recommend using tampons for a while, like months. I'm not kidding. Why would you want, if you had internal incisions in that area of the body, why would you want to aggravate it by shoving a piece of cotton up there? Think about it. You know what I mean? Because there's internal incisions that are healing. There's open wounds that are gaping, right? And if you're wondering what the hell I'm talking about, go to endowonders.com and look at my deep excision surgery webinar where I teach you all about it. Okay, so same goes for menstrual cups. Avoid those as well. So you can use pads, you can use period panties, whatever. Most doctors will tell you, oh, also, if you're going to use pads, make sure that they are toxin-free, clean, no fragrances, none of that crap. Most doctors will tell you the same thing, though, that like they'll tell you, but they're not really going to tell you, like, you know, I don't know how long to avoid it. Just listen to your body. Just go with your intuition. All right, that's a wrap for today's course. jessicawonders.com, endowonders.com. Find me online on social media at Sunfire Poppy. Thanks so much. Have a great day, guys.